I'm Wanda Boone. You can X the doctor because, hey, okay for that. But one of the things that I usually do when I stand before or sit before people like you is not to tell the whole story. So I'm not going to take a lot of time, but probably for the first time in these kinds of presentations, I'm going to give you a little bit more information than you have known about Together for Resilient Youth. And I had to write it down, otherwise I would go on a tangent and start to talk about everything else. So Together for Resilient Youth, Pinnacle Community Development Corporation, is a coalition of coalitions with multiple stakeholders from diverse ethnic and socioeconomic backgrounds and from humans learning to be in relationship. I think that's the most important part of what I want to share. And the coalition has youth ages 9 to 17, college-age students, young adults, health, schools, parents, higher education, law enforcement, local government, and trained and certified community health workers that are a part of the coalition. And we've been doing this since 2000, but before that I worked for 20 years as Senior Executive Director of Quality Assurance and Regulatory Affairs at LabCorp for all the divisions of LabCorp. So, and one of the things I want to say as well is that our community health workers are not just worker bees. We've made positive and sure that as they participate in all of the different things that we do, that they are facilitators and co-authors on the work that we do in research. That's so important. And I know that we're in this framework of, okay, you have community health workers, let me have them. But no, you're not gonna have them without CEOs who are actually doing the work behind the scenes. See, I'm going off on a tangent. So we consider ourselves to be bridge builders while keeping our eye on the most vulnerable. And some of our work has been adopted by CDC and SAMHSA, so we've done a lot. Okay, research. So in 1985, I started doing research with Duke on babies that were born with metabolic disorders, where we found a non-invasive intervention for Rye syndrome. So no longer did people have to lift the skull. And then when I worked at LabCorp in terms of research, it was the first time that a cocktail was identified for HIV through that research. So T.R.Y works across Durham, across North Carolina, across the nation, and also in Kenya, UK, and Australia, to do work in what I have coined to be transformative prevention, which has to do with collective impact grounded in data, trauma-informed, looking at individual, interpersonal, community, and societal benefit that takes into consideration the built environment, and that's all that T.R.Y does.